happy to address them in future health working groups, as we are encouraging to continue the efforts leading up to the summit. And with that, allow me to initiate this meeting with my opening remarks. Your Excellencies, as Ministers of Health, these challenging times have been an eye-opener. We have uncovered the gaps in our health systems and the endless opportunities of improvements. We have also learned the importance of taking all necessary measures, as severe as they may seem, to ensure the health, safety, and well-being of the population. And most importantly, we acknowledge our true heroes, our frontliners, who have been dedicated soldiers working tirelessly to combat this outbreak. During the G20 Virtual Leaders Summit in March, we as Ministers of Health were mandated to share national best practices and to develop a set of urgent actions to jointly combat the pandemic. On a national level, and by order of the custodian of the two holy mosques and His Royal Highness the Crown Prince, we in the Kingdom of Saudi Arabia have been undergoing a transformation that was initiated in 2016. The multi-sectoral initiative aims at creating a vibrant society that enjoys a thriving economy and fulfills the nation's ambitions. It has empowered us through the effective collaborations within the Kingdom on all levels to take on immediate, unprecedented national decisions to contain the outbreak of COVID-19. The preemptive decisions of implementing a temporary suspension of visits to the holy sites in Mecca and Medina has been introduced prior to the onset of any discovered cases within the Kingdom. This decision was taken immediately without hesitation, with the people's health and safety in mind first and foremost. Various measures have also been implemented in a timely manner, which is a testament to the joint goal of putting people's health first. We all agree that health is everyone's right, and in the Kingdom, by support of the leadership, all patients suffering from COVID-19, which includes citizens, residents, and even violators of residency laws, are to receive equal healthcare services free of charge in all public and private healthcare facilities, in an effort to ensuring the health and well-being of all those who reside within the Kingdom and to minimize the burdens of the outbreak globally. We also take note of the best practices shared by G20 members and their innovative, effective solutions in tackling this disease that have been essential in the development of all initiatives taken in combating COVID-19 globally. A set of urgent actions have also been developed to ensure proper global pandemic preparedness and response by furthering collaborations and engaging international organizations to facilitate coordinated responses in combating this pandemic, with emphasis on supporting countries in need. The actions also include operational responses to the outbreak and to invest in scaling up the COVID-19 response through research and discovery to produce technologies, tools, vaccines, and therapies for the treatment of the disease. As such, the Kingdom of Saudi Arabia has committed to allocate $500 million to finance the international efforts deployed to tackle this pandemic. We are also committing to global initiatives to speed up the development of a COVID-19 vaccine as part of our presidency's Pandemic Preparedness and Response Initiative. As G20 members, it's our responsibility to use this platform to introduce effective policy change through reaffirming previously introduced priorities such as AMR, as well as the implementation and reinforcement of our newly introduced joint priorities. Digital health has and will continue to be the most effective tool in which we can ensure rapid response and delivery of efficient, safe, and effective care. As such, a global task force is created to respond to pandemics and to hopefully preempt the onset of such outbreaks in the future. The Global Innovation Hub will serve as a joint platform for knowledge sharing to improve value in health. A global patient safety leaders group will be created to provide global shared platforms in order to reduce patient safety risks. All of these priorities will reinforce our commitment to UHC. We as Ministers of Health must commit to supporting the continuation of the health working groups on a monthly basis, and for us as Ministers to meet virtually in July and in October, leading up to the summit in November, to build on the priorities in place and to introduce effective outcomes that all G20 heads of states can commit to on a global scale. Your Excellencies, these priorities can only be executed through our collective policy response to this pandemic, and that is what we wish to achieve today. Thank you. Now, please allow me to give the floor to the Director General of the World Health Organization, Dr. Tedros, to give his remarks.
Thank you. شكرا جزيلا, Your Excellency. Assalamu alaikum wa rahmatullahi wa barakatuh. Your Excellency, Dr. Tawfiq Al-Rabi'a, Minister of Health of the Kingdom of Saudi Arabia, Excellencies, Ministers, colleagues, and dear friends. I would like to thank the Kingdom of Saudi Arabia for its leadership of the G20. I welcome the concrete actions the Kingdom is taking with the G20 Global Innovation Hub for improving value in health, the Digital Health Task Force, and the Global Patient Safety Leaders Group, and for its strong commitment to health for all. And thank you also, I'd like to use this opportunity to thank you for the generous support, the 500 million you just announced. And thank you for bringing us together today at this critical time. I would like to reiterate my appreciation to the G20 leaders as expressed in their recent statement, committing to further strengthen WHO's mandate in coordinating the international fight against the pandemic. We're all facing an unprecedented global health crisis. Not only are we confronting a new virus, we're also confronting the first pandemic in history caused by a coronavirus. All of your countries have been affected, and you are all at different stages of the response. We're encouraged that several G20 countries are now starting to plan how to ease social restrictions. It's critical that these measures are a phased process. Lifting the so-called lockdown restrictions is not the end of the epidemic in any country. It's just the beginning of the next phase. It's vital in this next phase that countries educate, engage, and empower their people to prevent and respond rapidly to any resurgence, to ensure they have the capacity to detect, test, isolate, and care for every case and trace every contact, and to ensure their health systems have the capacity to absorb any increase in cases. We're deeply concerned that the virus now appears to be gathering pace in countries that lack the capacity of many G20 countries to respond to it. Urgent support is needed, not only to support countries to respond to COVID-19, but to ensure other essential health services to continue. Since the beginning, WHO has sounded the alarm bell loud and clear, and we continue to fulfill our mandate to coordinate the global response, working with partners to save lives. We have engaged thousands of scientists and experts all over the world to develop detailed technical guidance for countries. We have shipped supplies of lab diagnostics and personal protective equipment to many countries and expanded testing capacity. We have provided training for more than 1.5 million health workers, and we have launched the Solidarity Trial to generate robust safety efficacy data about the 4 drugs under trial. The international community has rallied in support of the global response. More than $900 million has been pledged for the first strategic plan. That includes $150 million collected through the Solidarity Response Fund from more than 247,000 individuals and corporations. One of the biggest challenges we face in Africa and other countries is the critical shortage of supplies and the ability to deliver them because of weak supply chains. WHO is working with the International Chamber of Commerce, the G20, to increase the production and equitable distribution of these life-saving tools. Through the United Nations Supply Chain Task Force, we're working with the World Food Programme and other partners to distribute personal protective equipment to all countries around the world. Today, I have 3 requests. First, we urge each of your countries to continue to fight the pandemic with determination, guided by science and evidence. Second, we're looking to the G20 countries to continue to support the global response to COVID-19. We will soon publish a second strategic preparedness and response plan with an estimate of the resources needed for the next phase of the response. We echo President Ramaphosa's appeal on behalf of the African Union to G20 countries to support African countries with stimulus packages and debt relief so they can focus on fighting the pandemic. Third, we call on all G20 countries to work together to increase the production and equitable distribution of essential supplies and to remove trade barriers that put health workers and their patients at risk. The COVID-19 pandemic has reminded us of a simple truth. We're one humanity. We share the same planet. We share the same hopes and dreams. We share the same destiny. As the ministerial declaration recognizes, the current pandemic has highlighted system weaknesses in health systems and global preparedness. We welcome the commitment you're making not only to combat the current crisis, but to ensure this never happens again. WHO is committed to leading the work requested by G20 leaders in cooperation with our partners to assess gaps in global preparedness and to lay the foundations for the healthier, safer, fairer world we all want. Shukran jazilan, Your Excellency.
Thank you, Dr. Tedros. We will now proceed with country statements. We'll start with Troika members first, and we will then proceed with G20 members in alphabetical order, then guest countries, then regional organizations, and finally international organizations. Should the country called upon not to have an intervention, please say pass, and we will continue to the next country. And for the purpose of time, 3 times is given for each country statement. We would like to ensure that all countries and organizations have adequate time to make their remarks. So I ask that you adhere to the time given. And if you allow me, I will press the notification button at the 3 minutes mark. We would like to highlight the paragraphs in the declarations at the end of the meeting so that we are able to get a consensus on them. Please remember to silence your phones and unmute your microphones when speaking. And with that, Japan, the floor is yours.
Honorable Chair Minister Taufik, Honorable Minister Splat, Honorable Ministers, distinguished delegates, ladies and gentlemen, thank you for giving me the floor. First of all, I would like to express my deepest condolence to those who have lost their lives in this pandemic and my heartfelt sympathy to the many people facing this difficult situation. Under this extremely difficult situation, Minister Taufik constantly held health as a key theme for G20 presidency and convened this ministerial conference despite all the challenges. I deeply thank you and your team for your tremendous effort. Honorable Ministers, as one of the co-chairs, I would like to thank you for participating in this meeting despite your obligation to manage domestic response to COVID-19. Last October, I hosted this meeting in my hometown city, Okayama. I thank everyone who has participated. Since we last met in Okayama, the world has changed dramatically by the COVID-19 pandemic. This virus has no borders. Every country in the world is confronting this virus and desperate for help. I think now is the time for the G20 countries to lead the world. Regarding the COVID-19 situation in Japan, the number of cases are increasing, especially in the urban areas. We have a total of 10,361 cases at this moment. We have three basic strategies to control this virus: early detection and response to the clusters, behavioral change of the public, building up diagnosis and medical service capacities. For early detection and response to the clusters, we believe that aggressive epidemiological survey to identify the source of infection is important. For behavioral change of the public, that we have been repeating to avoid the 3C high-risk environment. 3C means closed space with insufficient ventilation, crowded conditions with people, and conversation in short distance. Given the nationwide and rapid spread of COVID-19, the government of Japan declared a state of emergency on 17th April in all 40 prefectures. People were requested to cut down 80% of their contact with other people. But this measure is different from lockdown. We are making a behavior change of the public while minimizing the impact on social and economic functions. Unfortunately, death cases in Japan have accumulated to 210. I'm reaffirming the importance of building a strong and resilient health system and achieving universal health coverage. I would like to express my sincere gratitude to the devoted health workers at the front line aims the risk of infection. As you know, Japan has been touching importance on achievement of UHC. I would also like to express my gratitude to Minister Taufik for including items such as value-based health care, digital health, and patient safety in the agenda of the Health Ministers meeting. These are all important topics where we move toward achieving UHC. As it is mentioned in the document, urgent action to combat COVID-19, provision of health care services, and development of treatment and vaccine are priority for all of us. Japan not only supports such effort in Japan, for example, clinical trial of favipiravir, known as Abigan, but also with international partners. For that purpose, government of Japan has decided to provide new contribution of $96 million to CEPI, and together with the Ministry of Foreign Affairs, $100 million to Gavi. G20 is playing a major role in overcoming the difficulties currently facing the world, including the development of vaccines. Let us all work together. Lastly, I look forward to having the constructive discussion with you all today. Thank you.
Thank you. Italy, the floor is yours.
Thank you very much. I wish to thank you and the Saudi presidency and commend the effort to manage the G20 at a time of global emergency due to the COVID epidemic. We appreciate the decision to maintain the commitment to this important appointment between the health ministers instead of postponing it. As the person responsible for the health of the country that we will have the honor of holding the presidency in 2021, I can assure you from now on that the program of our ministerial meetings will certainly devote ample space to the preparation and management of health emergencies and on the modalities for coordination within the international community, which I believe has been a crucial issue from the very first hour of this crisis, as I have stated several times in various international forums. As far as the current situation is concerned, Italy was one of the first countries in the world and the first in Europe to face the COVID epidemic, which has put a strain on our healthcare system and especially on our intensive and sub-intensive care. Even though we have indeed experienced some tragic days in our hospitals and our national territory, this health emergency has shown that our universal health system, established in 1978, is indeed an essential resource, as well as an asset on which we must invest future resources, according to a strategic outlook aiming at improving its resilience. In this perspective, the concept of value-based healthcare, discussed in the first technical preparatory session of the summit in January, is extremely relevant. In Italy, we are currently on the right track, thanks to the measures enforced to date, and we are beginning to witness a slowdown in the contagion. However, we must not consider this result like an end point, because the epidemic is still underway and has not yet been defeated. We are therefore currently working for progressive steps towards a recovery in production and social life, but at the same time, we should still enforce rigorous measures that must include the maintenance of physical distancing and the safe individual practice, even in the workplaces that we are going to reopen, in order to avoid new outbreaks. The strengthening of the connection between hospitals and the territory, and the strengthening of the network of local services with a renewed integration between health and social policies, and in deep serological survey of the population in order to have more evidence on how much the virus has circulated. As we approach this new phase, the use of digital health, which was the theme of a second event of this G20 a few weeks ago, will also be essential, other than supporting us in managing patients who are not hospitalized because they are paucisymptomatics, such as an initiative also promises to help developing early diagnosis of new cases, as well as tracking any contacts that might be at risk. Another critical aspect, which has also found its place on the initial agenda of G20, is patient safety, which goes hand in hand with operator safety. After the first day in which the emergency services were mostly focused safeguarding of vital parameters, even though invasive respiratory supports the progressive knowledge of SARS-CoV-2 behaviors, the disease and the mechanism that determine it led to the start of a series of experimental treatments. Well, procedures and treatments, even in emergency phase, must guarantee maximum safety, and this perspective we intend to maintain the activity of hospitals that were specially set up and dedicated to the COVID-19 infection. Closing them would be a mistake, because having dedicated hospital is essential in order to avoid further contagions and cross-contamination in general hospitals. Finally, Italy has launched several critical clinical trials and collaborations between research centers and the pharmaceutical sectors, entrusting the general direction to the National Drug Agency in order to guarantee a unique controlled approach and careful monitoring of the treatment in use. In conclusion, I would like to reiterate the absolute importance and indeed the essential need for a common and coordinating effort to deal with this emergency, which will certainly not end in a few weeks. in order to be prepared to deal with other future events altogether. Although I do wish to thank WHO and all those countries, including the G20, which have shown to be close to my country. We will never forget that. What is called for is coordination of such initiatives, as well as a decisive and rapid leadership that will be able to route them in a orderly, organized flow, allowing to cut down in times of essential research, share knowledge and experience, and deploy human resources and means of the basis of prearranged programs, because epidemic health emergencies know no borders, and we must equip ourselves accordingly to deal with them together. Italy is ready to play its part in the international forum. Thank you.
Thank you. We now open the floor for all countries in alphabetical order to give their statements, starting with Argentina. The floor is yours. Australia, the floor is yours.
Thank you, Your Excellency, Dr. Tawfiq, Dr. Tedros, distinguished health ministers and colleagues. I join others in commending the G20's leadership during the unprecedented challenge presented by the COVID-19 pandemic. As a collective of the world's largest national economies, we are well positioned to both prime our health systems to respond to the pandemic and to assist countries with vulnerable health systems through collective efforts. G20 health ministers are a key link to other sectors of government, integral to facilitating the urgent actions to respond to COVID-19 by working closely with trade and finance ministers and others. I acknowledge the essential normative role of the World Health Organization in setting global frameworks for action and coordination. The WHO has a critically important role supporting countries with vulnerable health systems to build their capacity to prepare and respond to the pandemic. Australia is working across government and with society and international partners to respond to the pandemic. We are determined to minimise the potentially devastating impact of the pandemic on our community and on those in our region and beyond. Australian institutions are playing an active role in the global pursuit of treatments and vaccines for COVID-19, with several trials of candidate vaccines already taking place in our country. We welcome the global leadership of the Coalition for Epidemic Preparedness Innovations, CEPI, in initiating a program of rapid vaccine development as well. In all aspects of the response to COVID, from diagnosis to treatment and in time to vaccines, we must ensure that populations are treated equally and effectively and not disadvantaged by responses to COVID-19. Communities more vulnerable to infection should be prioritised and protected on both health and economic fronts. In Australia, we are implementing a comprehensive response under our National Health Sector Emergency Response Plan. This includes strict social distancing and quarantine measures, extensive information campaigns for the public, and telehealth services in our primary care system. Australia is also looking to how restrictions can be eased in the future, but we firmly believe we cannot ease measures too quickly and call on others to be cautious also. Regarding value-based healthcare, Australia recognises that value in health as an important aspect of achieving sustainable universal health coverage, enabling quality, effective and affordable services for all people and when and where they need them. Antimicrobial resistance is an enduring global threat, and we welcome the continuing theme at this G20 gathering in 2020. Promoting One Health approaches to AMR, as well as development and implementation of AMR national action plans, should continue to be a focus for us all. We are committed to continuing work with G20 members on AMR, including sharing relevant work undertaken to date, such as our own new national AMR strategy. Australia recognises the value of digital innovation as a health system enabler to access hard-to-reach populations, to uncover data-driven solutions, to improve quality and safety, and to achieve efficiencies. Australia is harnessing digital solutions to support health systems during the COVID-19 pandemic, including telehealth and electronic prescribing. Finally, on patient safety, we are encouraged by the global momentum starting in 2019, including through the World Health Assembly, 2020 sees compounding factors for harm to patients as health systems' capacities are stretched, heightening safety risks for both COVID and non-COVID patients. We remain committed to improving patient safety in order to reduce all avoidable risk of harm to all patients and people during their interactions with healthcare systems. In closing, Australia thanks the Kingdom of Saudi Arabia for mobilising the G20 Health Track and G20 Ministers of Health, Trade, Finance and many others to address urgent needs in response to the pandemic and harnessing the expertise and mandate of international organisations in these collective efforts. We look forward to continuing to collaborate with other G20 tracks in these efforts ahead of the Leaders' Summit later this year. Thank you.
Thank you. As I indicated before, each intervention to be 3 minutes to allow us time to agree on the declaration during the last hour. In the last hour, we would like to discuss the proposed text for 2 pending paragraphs in the declaration and the G20 urgent action document. As our leaders expect us to deliver on this, again, we thank you for all your inputs to the declaration and urgent actions, where we have circulated these documents that are consistent with the leaders' statement and views. Okay, so we will move to Brazil.
Okay, so Mr. Chair of the Health Committee, Ministers of Health, ladies and gentlemen of international organizations, ladies and gentlemen. So the urgency of COVID-19 is confronting us all. This is critical. And we congratulate this G20 Health Ministers meeting. It's unique, considering the deep challenges this pandemic brings to the social and economic well-being of our population right now. Congratulate for the G20 presidency for the hard work during the regular and extraordinary activities of the Health Working Group this year, and welcome the G20 leaders' statement on COVID-19. Taking into account that this is my first international participation as Ministers of Health of Brazil, I want to take this opportunity to reinforce the Brazilian commitment to work together and find solutions to tackle the main global health challenges. Dear colleagues, the COVID-19 pandemic has been hitting our health systems and economies worldwide, from the least developed to developed countries with no exceptions. I would like to highlight the importance to avoid polarization between economic and health sectors, the need to align direction. I think this is one of the problems we have. It's when we separate health care and economy, because both have to work together. It's not a separation. This is critical to have a collaboration between these parts of the systems. National governments are acting on emergency to redesign models of care and to guarantee access for an increasing number of people in need, trying to avoid worse collapses. The necessity to test all population in order to guarantee an adequate response. This response must consider the population dimension of its well-being, regional context, and economic impact in our societies, and the need of intersectoral and integrated actions above the health sector. So, in talking a little bit about testing, I think it's critical for us to understand the disease. I think we have some main critical points to better understand the disease and the evolution, how to prepare the system to have this huge number of patients coming at the same time, and to define the next steps. I think that when the way we're going to use the tests, it will be possible to test all the population, but how to use the tests in a way we can better understand how the prevalence, the incidence of the disease, its evolution. So one of the questions is, today we know that herd immunity is like 70%, and in the countries, Brazil, for example, even if we use 100 times more than we can have diagnosed, it's just 1.7% of the population. So how to deal with the economy, healthcare system, when we have just 1.7% of the population with the problem, and we have 280 million people beyond those people infected with the virus. So it's a challenge not only to take care of this condition, but to keep paying attention to all the population. So the Ministry of Health of Brazil has adopted full transparency in the communication about COVID-19 surveillance and control actions. In addition to combating fake news, this is a problem. Have defined national protocols on surveillance, testing, primary care, and tertiary care. Brazil federal government has allocated over $2 billion for strengthening health actions in states and municipality levels, coordinating medical supply procurement and distribution of PPEs, laboratory tests, pulmonary ventilators, workforce, logistics, and communication. Okay. So Brazil recognized the role of WHO as a global health organization and the importance of its work around the world. At the same time, we want to highlight the need to have an integrated approach with other organizations, as well as to measure the performance. I think that the more important the organization, the institution is, the more it's critical to show the benefits that come from this institution. So I think it's having measurements of clinical outcomes will be critical. There's no easy way to execute the crisis, and I believe health systems will never be the same after this experience. Our countries should further commit to achieving universal health coverage and to building resilient, efficient, and quality health systems focused on the needs of the population. Thank you so much.
Thank you. Canada, the floor is yours.
Well, good day, everyone, and I'd like to thank the Kingdom of Saudi Arabia for hosting this G20 meeting and an opportunity to meet during these unprecedented times. I welcome the Presidency's focus on value-based healthcare, patient safety, digital health solutions, pandemic preparedness, and AMR. Each priority also has important and real links to COVID-19 response. In recent months, we have seen reinforced the importance of robust health systems at national and local levels, adequate protection for healthcare workers and vulnerable populations, and of international collaboration to protect the health and safety of our populations. I will outline Canada's actions to stop the spread of COVID-19 outbreak and to minimize the health, social, and economic harm. Since the outset of the COVID-19 pandemic, all levels of government have been working together and in cooperation with international partners, including the World Health Organization, to ensure that Canada's measures are appropriate and adaptable, science-based, and evolve as the situation does. Existing law and pandemic planning tools have helped us to move quickly to take extensive measures to combat the outbreak in Canada. Today, I will share some of our strategies. We have put in place a multi-billion-dollar fund to strengthen the healthcare system as well as support people, businesses, and industries. This includes a $1 billion government-wide COVID-19 response fund through which we are investing heavily to enhance our capacity to test antivirals, develop vaccines, and support clinical trials. Early-stage clinical trials for COVID-19 vaccines have already begun around the world, and Canada is working with vaccine developers and manufacturers to help expedite the development and availability of vaccines to prevent COVID-19. Our research agenda is aligned with the World Health Organization Global Research Roadmap, and we're pleased to be part of the World Health Organization Solidarity Trial on possible treatment options. We're investing to enhance surveillance, to increase testing, and to provide ongoing support for the preparedness in Indigenous and Inuit communities. We've also taken important steps to protect seniors. Given that a significant number of COVID-19 related deaths in Canada have occurred in long-term care settings, we released specific guidance for long-term care homes to support the staff, volunteers, and residents of these facilities. We have also provided increased support for women, children, and other vulnerable populations and have invested in mental health services, shelters, and other social support initiatives. Canada has a long history of investing in public health functions such as health promotion and people-centered care, strengthening our ability to respond to this outbreak and reduce the impact on our healthcare system. For example, protocols for infection prevention and control already put in place by the patient safety community meant we were ready with sound practices to reduce the risk of transmission to other patients and to healthcare professionals. Rapid expansion of digital technologies such as virtual care are increasing access to physical and mental health services even while the country practices physical distancing. We are concerned that COVID-19 is driving an increased or inappropriate consumption of antibiotics, which could lead to an increase in drug-resistant infections. Canada's multi-sectoral response activities continue to evolve based on the best science available and the lessons we are learning from this crisis, which will be equally important as we look to recovery and planning for a new normal. And we welcome the World Health Organization's recent guidance and advice in this regard. This pandemic is affecting us all, and international collaboration is more important than ever. In particular, we would urge global solidarity in supporting the World Health Organization's leadership during this time. Their efforts in coordinating a global response to the pandemic under the Strategic Preparedness and Response Plan allows them to do what none of us can accomplish on our own. We must also continue to protect those at risk, including seniors, women, children, and those experiencing homelessness and mental illness. We're very concerned about the potential of this pandemic to exacerbate existing gender and other drivers of inequality, including the undervaluing of care work that women historically provide. In fact, the pandemic has highlighted once again that inequality is a threat to us all. We need to maintain robust global supply chains for essential medicines, medical support and equipment, as well as food, and to refrain from export bans. In the coming weeks and months, it will also be important to support the financing needed for urgent research and development, equitable distribution of vaccines, therapeutics, and diagnostics, and working closely with partners such as CEPI and Gavi, the Vaccine Alliance. We encourage all G20s to work together in these regards. Mr. Chair, the G20 Health Ministers' Declaration we have before us demonstrates that our collective will to take decisive actions are called for and welcomed by our leaders in their statement. Canada is committed to a continued collaboration as we learn to and adapt our domestic measures and global responses to the pandemic. When this pandemic ends, we must commit to a comprehensive post-crisis review, and we must strengthen our work to protect global health, and we will need to recommit together to ensure we foster our collective work to leave no one behind. Thank you.
Thank you. Now back to Argentina. The floor is yours.
Good morning and good afternoon to everyone. Greetings on behalf of our Minister, Dr. Ginés González García, and special thanks to the delegation of the Kingdom of Saudi Arabia for hosting the G20 Health Ministerial Meeting, as well as all participating countries, international organizations, and engagement groups for their collaboration in these difficult and challenging times. It is my great honor to be part of this event. As it was mentioned before, the outbreak of coronavirus, first detected in December 2019 in Wuhan, China, has taken the world by surprise and confirmed how infectious diseases that are potentially pandemic pose a threat to international, regional, and national health systems. COVID-19 has shown the global health challenges cannot be addressed by a single country or only by the health sector. Instead, they require a comprehensive commitment of several actors, and it is the role of the health sector to show leadership and guide the required activities, as well as raise awareness of the risks and possible consequences. Argentina deployed a prevention strategy to reduce the amount of infected cases by the novel coronavirus. Within this strategy, a package of early and incremental measures was implemented in order to mitigate the initial spread and health impact of COVID-19, and they allowed us to better prepare our health systems to detect the arrival of infected people in order to slow down its dissemination. In order to set up a coordinated and multi-sectoral strategy, Argentina has established a general coordination unit of the comprehensive plan to prevent public health events of international concern, coordinated by the Chief of the Ministerial Cabinet and composed of all ministries involved. Argentina recommended preventive self-isolation on the day 4, considering the detection of the first case, and social preventive and mandatory isolation was ordered only 2 weeks after the first case. This measure was highly observed by the whole society. In addition, classes were suspended, public events were cancelled, and telework and telemedicine were implemented, among other measures, all in an early way. These measures were taken along with a set of actions aimed at reducing the social and economic impact produced by isolation. The epidemiological surveillance and COVID-19 diagnostic system was strengthened. Physical health resources and institutions' capacities were readapted and reassigned, and human health resources were reinforced. At the national level, a technical expert and researchers group was established, which investigates potential scenarios to define the social, economic, and cultural impact of the pandemic on our country, elaborating proposals for public policies design. In addition, the Ministry of Science, Technology, and Innovation of Argentina launched a special call for research, development, and innovation projects aimed at improving the national response capacity against coronavirus and fostering the creation of associative, interdisciplinary, and interagency consortiums for directing resources and efforts. Argentina constitutes a national health equity fund to allow all citizens to access to diagnosis, ambulatory and inpatient quality services related to COVID-19. Our country has been invited to participate in the WHO multi-country solidarity clinical trial, a study which will enable the evaluation of different therapeutic options for COVID-19 and reflects our commitment with international cooperation initiatives. Argentina is a federal country that promotes a value-focused health system that provides sustainable access to quality health services. Although all countries have made huge progress in improving population health overall, such progress is uneven. We need to develop person-centered health systems for improving value in the delivery of healthcare services in all care pathways, investing in cost-effective prevention with particular attention to the main risk factors of NCDs and primary care, as well as placing digital health as a key element to ensure healthcare services. For Argentina, improving patient safety in healthcare is a priority and a challenge shared with all the countries of the world and constitutes a priority policy on the public health agenda. In this framework, the country co-sponsored in 2019 the resolution Global Action on Patient Safety, adopted all at the 72nd World Health Assembly. Along these lines, Argentina supports the establishment of a group of leaders as a mechanism that facilitates the development of innovative solutions, brings together key actors, and provides new tools that complement those already developed in other areas, such as international and civil society organizations that promote intervention under the focus of patient safety. In accordance with the recommendations of the World Health Organization, Argentina has started the implementation of the National Digital Health Strategy. This strategy is a tool that works as a guide for the development of health information systems to close the existing gaps. We are willing to collaborate in the creation and implementation of the digital health framework. However, it considers it necessary to bear in mind that the Digital Health Working Group or task force must maintain coordination with the existing lines of work and promoted by different actors and sectors in order to avoid overlapping or duplication of efforts towards the same objective. Regarding AMR, although Argentina and most of the countries make progress on the implementation of national action plans in the framework of the One Health strategy, there is still much to be done, and the G20 countries should be the example. To fight AMR, we have to work together and with the key partners through multi-sectoral agreements and in collaboration with international organizations. In that sense, Argentina has co-sponsored resolution WHA 72.5 antimicrobial resistance, which was adopted at the 72nd World Health Assembly in May 2019. There was a strong agreement in the promotion of measures to raise awareness of the AMR problem among the population and health workers, as well as the need to encourage investment in technology and access to new diagnostic technologies. To conclude, I hope we can continue working together to tackle this pandemic and continue our efforts to strengthen our health systems. Thank you.
Thank you. China, the floor is yours.
Facing the COVID-19 outbreak that caught us by surprise, we adhere to law-based, science-driven and targeted containment strategies, emphasize the approach of taking early precautions and mobilizing grassroots by boosting community engagement. As of 21st of March, the total financial investment on epidemic control from all levels of governments across the nation has reached 121.8 billion Chinese yuan. After over 3 months of hard work, the local spread of COVID-19 in China has been basically curbed. Life and work are quickly returning to normal, yet there is no way we will lower our guard or relax control. We are collaborating with WHO as well as international community of the outbreak in a very open, transparent and responsible manner. Starting from January the 3rd, China started regular reporting of the viral pneumonia of unknown cause to the WHO. After the pathogen was identified as the novel coronavirus, on January 11th, we shared the whole genome sequence of the novel coronavirus with the international community, and subsequently published the virus primers and probes, which provided the basis for global epidemic surveillance. From January 20th to 21st, we have invited WHO expert team to visit Wuhan. In mid-February, WHO China joint mission conducted a visit in Beijing, Guangdong, Sichuan, and Wuhan. In 4 provinces and cities, it's a 9-day field visit. They also issued a report, which became guidelines for global epidemic prevention. We continue to improve protocols for diagnosis, treatment, and epidemic prevention, guide public health and medical personnel across the country. We have shared China's protocols with the world through the Online Knowledge Center. As of mid-April, China has hosted and attended more than 50 video conferences. We conducted technical exchanges with counterparts from various countries. We have provided epidemic containment materials to 127 countries and 4 international organizations. We have sent expert teams to 15 countries to provide anti-epidemic technical support. Distinguished ministers, delegates, to implement the consensus of extraordinary G20 Leaders Summit, I would like to put forward 3 proposals. First, supporting the World Health Organization in response to the outbreak. We call on the G20 to continue to firmly uphold multilateralism, to support the leading role of WHO in coordinating global public health emergencies. Second, actively developing joint prevention and control with the international community. We call on the G20 to beef up epidemic containment and treatment capacities in light of our national conditions. We need to actively cooperate in the development of drugs, vaccines, and prevention measures, and effectively stop cross-border spread of the virus. and we call on the international community to unite and resolutely oppose rumors, stigma, and discrimination. Third, working together to help countries with weaker public health systems to improve their response capacity. We will continue to update the online knowledge center for China's experience and response to COVID-19, continue to share prevention, control, diagnosis, and treatment protocols, and extend assistance within our capacity to countries in need. While addressing the challenges of COVID-19, we should not ignore the threat posed by traditional infectious and non-infectious diseases. We welcome the Saudi G20 presidency to include value-based healthcare, digital health, patient safety, and antimicrobial resistance as key issues for cooperation. And we are looking forward to discussions on the relevant initiatives of the joint statement of the G20 health ministers. Thank you.
Thank you. European Union, the floor is yours.
Thank you. Honorable President, honorable members, honorable ministers, I'm very grateful to the Kingdom of Saudi Arabia for leading the G20 presidency through these very challenging times. I welcome the priorities under your presidency to strengthen value-based healthcare, digital health, patient safety, antimicrobial resistance, and of course, pandemic preparedness. The EU, like many countries and regions around the world, has been hit hard by the COVID-19 pandemic. The G20 is indeed the right forum to discuss joint measures we can take to halt the outbreak and also to share best practices. In the European Union, we are mobilizing all means possible to protect our citizens and to strengthen the resilience of our hard-hit economies. We are grateful for the support we have received from our friends around the world to deal with the pandemic, and several of them are here amongst us today. Our priority is to flatten the curve of infection and to give our health systems and workers the time and space to care for those in need. The European Union has taken a very proactive stance to guide our member states in this effort, and we are pleased that we are finally and gradually starting to see good results on the ground in terms of the curves. I cannot stress enough that we must all collectively do everything in our power to safeguard these global supply chains. As our independence across the world is evident, cooperation and solidarity is the only answer. Strong international cooperation and the contribution of international organizations is critical here. And efficient multilateral solutions are essential to contain, mitigate, and eventually overcome this pandemic. For our part, we will support strengthening partner countries, health, water, and sanitation systems, and their research and preparedness capacities to deal with the pandemic. We have secured financial support amounting to more than 15.6 billion euro in order to do this. The G20 must use its influence and mobilize all countries to rally behind this common goal. And towards this, finding an effective vaccine and ensuring equitable access is a global #1 priority. It is for this reason that on May 4th, the European Union took the initiative to lead global efforts and will host a global online pledging conference, teaming up with partners around the world to urgently close existing funding gaps. The role of G20 is nothing short of essential for this. We all have to respond to this call with responsibility, and I call on all of you to rally behind this initiative and to pledge money to support research for a COVID-19 vaccine and improve diagnostics and treatments. We have in Europe started to look cautiously towards the future. The extraordinary measures taken by member states and the EU to contain the virus have slowed its spread, but they have come at an enormous cost. This week, we put forward a European roadmap with recommendations to support a coordinated phasing out of confinement measures, supported by guidelines and recommendations, including the use of mobile applications to support social distancing, prevention and contact tracing. And as we gradually lift containment measures, we must develop a strategic recovery plan to revitalize the economy and return to a path of sustainable growth. As we draw lessons for the future, we need to work for our pandemic priorities, which include the transition to a greener and more digital society, and AMR. Antibiotics are used to treat COVID-19, and it's another stark reminder of the potential impact of this global threat. The EU and its member states will be putting forward a resolution on COVID-19 for adoption of the World Health Assembly in May, and we will welcome collaboration and input from G20 partners. Honourable Ministers, it is evident that a strong and coordinated global response is required to mitigate the devastating health, social and economic consequences of the outbreak. We have no choice but to look to the future with hope and resolve. We must all together pool all our tools at our disposal and work closely together to overcome the pandemic and be better prepared for the future. We must collectively rise to this occasion.
Thank you. Now, France, the floor is yours.
Thank you, Mr. Chairman. Dear Honourable Chair, dear Ministers, dear colleagues, I would like to thank first the Saudi Presidency for holding this virtual G20 Health Ministers meeting today in such a critical context, offering an opportunity to exchange on this unprecedented crisis we are all facing today. As you may know, at this time the pandemic is very active in France, but for the past few days the national situation now follows an encouraging trend since we have been observing a high-level plateau. Despite the improvement of this epidemiologic situation, confinement would last until May the 11th in France in order to protect French people, to preserve our resuscitation capacity and the resilience of our healthcare system. In this context, there is a need for sharing information on good practices, and let me share though with you our French experiences in three main areas of our health crisis response. First, ensuring the resilience of our health system is one of the French priorities, and to be sure that no one is left behind, our health system resilience strategy relies on three objectives: to increase resuscitation capacity, material resources, and limit the pressure on healthcare services. Second is to reinforce healthcare workforce in all territories. And then finally to transfer patients to less affected regions or even to neighboring countries. Secondly, what can we share regarding pandemic planning, which is also decisive in the epidemic management? In that regard, national plans should ensure multi-sectorial coordination at national level through crisis cell or task force activation. France has updated its national pandemic prevention and response plan in order to ensure multi-sectoral coordination, and there's a specific task force on COVID-19 which is activated to ensure a coordinated and intersectoral approach. Finally, public information and communication to our citizens is also a major challenge in order to overcome fears and fight against disinformation, which is high. France is very committed in this area thanks to a multi-sectoral communication strategy, which is included notably social media or telephone platforms. Beyond knowledge sharing, it is now essential to continue to work together under the stewardship of the World Health Organization to strengthen national, regional, and global pandemic response and preparedness. Today, dear colleagues, the declaration that we could adopt has to show clearly our willingness to work in close cooperation to fight the COVID-19. All together, countries and international organizations, and WHO is the preeminent international organization at the core of health issues. Of course, after the crisis, we will have to assess the impact of our collective and public actions, including those of WHO, and to agree for improvements. But today, our current and full support of WHO's mandate is crucial to be highlighted in our declaration, just as our G20 leaders already mentioned it in their declaration, and that is for us a red line. More than ever, we must also support African emergency health response capacity and public health system. In this regard, efforts taken by the United Nations, and especially the World Health Organization, as well as agencies and financial facilities such as the Global Fund, United or Gavi, are crucial. In order to increase capacity and resilience of health systems in all countries, we call for new efforts to develop innovative medical training and to improve epidemic preparedness knowledge by leveraging the WHO Academy in Lyon. In light of these challenges, dear colleagues, and the common responsibility we share, this crisis demonstrates how interconnected we are. No region can win alone the battle against COVID-19, and our solidarity among countries is more than ever essential, and I am confident on our capacity to overcome this unprecedented crisis altogether. Thank you.
Thank you. Germany, the floor is yours.
Mr. President, let me sincerely thank the Kingdom of Saudi Arabia for organizing today's virtual meeting and putting really pressing points on our common agenda, which is very important in those times. And let me maybe start by a little bit recalling what we did 3 years ago under the German G20 presidency. And maybe some of you will remember that we undertook a simulation exercise of a disease outbreak in 2017. And I have to confess, I would have never imagined that the outbreak will become reality so quickly today in 2020. Hitting all of us in all our countries, having no effective treatment in place, and especially no vaccine in place. And that is why, indeed, like others said, we have to share our best practices, and we have to learn from each other, and we have to cooperate all together. In Germany, we would like to share 4 best practices that we have implemented during the crisis. The first one is it's very essential to have fast and effective and efficient decisions to be implemented, especially in countries like mine, where we have very federal structures. It's important to have all stakeholders on board and take and implement decisions and measures country-wide. The second one is the testing capacities, and I guess we are all in the same situation to continuously increase our testing capacities. We are now on a weekly basis beyond 600,000 cases as a capacity, and we are still increasing further. The third one is, like others, we are constantly increasing our hospital intensive care units, which is very, very important. And we have given financial incentives to hospitals to do so. And the fourth one, of course, is to find the right balance between decisive measures to be implemented, especially on social distancing, and at the same time find the right time and the right balance to relax at least some of them over time. So, given these national experiences and national best practices, today is the time to also take bold, decisive actions all together as the G20. And that is linked to what already others said, what especially just France pointed out, that also Germany fully supports the WHO leading and coordinating role in the global response to COVID-19. Germany, secondly, supports CEPI with additional 140 million euros to find a vaccine. And again, to echo what Commissioner Kyriakides just said, this is the very, very crucial point to find a vaccine as soon as possible. Third point is that, of course, we contribute the WHO solidarity trials for therapeutics to help to generate the evidence we need as fast as possible to treat patients with COVID-19. And the last point, like others said, is we share that there is a need of a full review of the global response to the pandemic, and we would see an added value to do that as a lesson to be learned once the pandemic is over, but not during the pandemic at the same time. And allow me to mention the very last point, like others, that we should never forget that there are other pressing challenges, especially like AMR, and sometimes closely interlinked between AMR and the current pandemic. And that is why we really think that we need to continue with our joint efforts to implement the global action plan on AMR to maintain the effectiveness of existing antibiotics. Thank you.
Thank you. India, the floor is yours.
Thank you, Chair. DG WHO, Excellencies, Ministers at G20. Global health crisis, the likes of which the world is witnessing today, creates an opportunity to dive deep into the nature of what connects us all, while at the same time providing us with the collective strength and wisdom to accomplish. In the past, we as a global community have faced and successfully tackled threats to health of our people by a collective sense of purpose, supporting and collaborating with each other. I look forward to similar cooperation and mutually respectful and useful collaborations to deal with the coronavirus disease COVID-19. While some of the countries, particularly Japan, Singapore, South Korea, have fared well, others are still struggling with COVID-19. The scale of impact is unprecedented and therefore calls for cooperation between nations to attain normalcy. Excellencies, India has successfully tackled public health emergencies of international concern and pandemics in the past as well. This time, the hallmark of our approach has been fivefold: maintaining a continuous situation awareness, preemptive and proactive approach, graded response as per continuously evolving scenario, intersectoral coordination at all levels, and lastly, but most importantly, creating a people's movement to combat this disease. Our efforts have been preemptive and proactive. We started surveillance of flights from COVID-affected countries 12 days before we even had the first case in India on the 30th of January 2020. By 22nd of March, with less than 400 cases, we banned all international flights to and from India, and by the 25th of March, implemented a nationwide lockdown. As of today, the 19th of April, we have completed 25 days of lockdown, which will further extend till the 3rd of May. The results of the same were realized when our case doubling rate, which was about 3.4 days on the 17th of March, dropped to 4.4 days by the 25th of March and is currently about 7.4 days. Much before the outbreak was declared a public health emergency of international concern by the World Health Organization, India was much ahead in implementing actions targeting core capacities as mandated under the international health regulations. Our nation has the requisite national core capacities stipulated in the international health regulations to manage public health emergencies. The Integrated Disease Surveillance Program, which is a nationwide surveillance system for epidemic-prone diseases, has been activated towards COVID response and is being further strengthened with substantive digital inputs. India has made the conscious decision to focus on building exclusive infrastructure for management of COVID patients so that there is no intermingling of COVID patients. All the people who are tested positive are treated in one of the 3 types of dedicated COVID management centers: COVID care centers for mild symptomatic cases, COVID health centers for moderate cases, and COVID hospitals for severe cases. These dedicated COVID facilities are mapped to each other in the design of a referral network architecture for dynamic movement of patients as symptoms evolve, so that optimal clinical care can be provided timely, commensurate to symptoms. In the absence of any specific drug or vaccine, India has also relied on various non-pharmacological interventions. Particular focus was on measures like social distancing and risk communication to the masses, on simple public health interventions like hand hygiene and respiratory etiquettes. While the traditional ways and means to tackle the disease were being implemented, our scientists and doctors are exploring new and innovative measures to maximize our reach. Cutting-edge technology is being used to not only maintain inventory and patient-level information. Direct-to-citizen apps are being used for communicating geospatial risk and best practices to be followed. Excellencies, since the onset of this pandemic, India has taken leadership and assisted neighboring countries in multitude of ways. During medical evacuation undertaken by India from Wuhan, China, as well as from COVID-19 affected Diamond Princess cruise ship, we evacuated foreign nationals from Maldives, Bangladesh, Myanmar, Maldives, South Africa, USA, Madagascar, Sri Lanka, Nepal, South Africa and Peru. India, as a global leader in pharmaceuticals, has stepped to make sure supplies of drugs like hydroxychloroquine is made available to countries around the world. India is working with global partners to ensure that effective drugs and vaccines can be developed and made available to all of us as soon as possible. Honorable Chair, I would like to reiterate India's support to this global health agenda. India looks forward towards working with G20 member countries to pursue unified efforts towards mitigation of COVID-19. Thank you.
Thank you very much. Now, Indonesia, the floor is yours.
Let me begin by commending His Excellency Minister Dr. Taufik bin Fahsyan Al Arabia for chairing this G20 Health Minister meeting. Excellency, our world today is coming together to fight common enemy, the COVID-19. With the impact is not only on health, but also social and global economy. We are very saddened by the suffering of people around the world and the death of frontline health workers to against COVID-19. In line with G20 leader statement on COVID-19 endorsed by extraordinary G20 leader summit last month, Indonesia fully support to strengthen collaboration among all stakeholders to end this pandemic. We must take all necessary measures and ensure sustainability of financing to protect people from pandemic. The government of Indonesia has formulated a series of policy and instruments in comprehensive, decisive but measurable manner to fight COVID-19. The President has established the task force to accelerate our measures on prevention, detection, and response to fight COVID-19 in all aspects of health, social, and economy, including its sustainable financing, and to strengthen coordination between central and provincial or district government. We engage cross-sector, private, and community to fight COVID-19. We are confident that through work together, Indonesia will stop COVID-19. As a group of G20, we must act together in a unified, swift, and synergized action to first, ensure availability supply chain open for essential medicine and medical equipment for all countries and promote joint production. Second, expedite the invention of antiviral and vaccine for COVID-19 through joint research. Third, support strengthening national health capacity of country need. Indonesia stands ready for global action to end this pandemic. We are ready to support upscaling production of a new COVID-19 antiviral or vaccine by empowering national medicine and vaccine production for global need. Excellency, Indonesia appreciated the initiative taken by the President of G20 of Saudi Arabia in bringing other important issues of value-based healthcare, digital health, patient safety, and antimicrobial resistance that very relevant in supporting our effort. We recognize that there are some challenges in the implementation of those agenda, but we must confident that through strengthening collaboration, we can improve our capacity to address the challenges. Therefore, Indonesia supports the draft G20 Health Minister Declaration and G20 Urgent Action to combat COVID-19. Indonesia, in its own part, has been conducting efforts to improve our capacity on value-based healthcare, digital health, patient safety, and antimicrobial resistance by enacted related law and regulation, developed national action plan, improve system and mechanism, increase capacity and facility and technology, enhance of health human resources, and ensure sustainable financing. Finally, I would like to deliver some Indonesia salient point on the initiative that will adopted through this meeting as follows. First, Indonesia support the establishment of G20 Global Innovation Hub for improving value in health and ready to engage. Second, Indonesia welcome the establishment of G20 Digital Health Task Force and the development of digital health guiding framework for innovation and transformation. Third, Indonesia support the establishment of G20 Global Patient Safety Leader Group that bridging the implementation gap and reduction patient safety risk and increasing quality of healthcare services. The antimicrobial resistance is inevitable because of potential secondary infection that occur in hospitalized patients infected with COVID-19. Thank you very much.
Thank you. Thank you. Mexico, the floor is yours.
Thank you, Chair. Ministers, heads of delegations, representatives of international organizations, colleagues. Mexico appreciates the Saudi G20 presidency's initiative to organize this health ministerial virtual meeting, which gives us the opportunity to discuss the global response to the COVID-19 pandemic, as well as other priorities put forward for this year. The world is facing an unexpected challenge due to COVID-19. Health systems are under enormous strain, and as are our economies and our societies. This calls for an urgent, robust, comprehensive, coordinated, and effective response based on scientific evidence and sustained political will. The G20 is an appropriate forum to generate this collective response, as was expressed by our leaders at the recent virtual summit. Mexico recognizes the key role of the World Health Organization in coordinated international health actions and would like to express our support to its leadership and guidelines during the current crisis. We also have called for increased system-wide coherence across the UN system and greater coordination among all relevant multilateral, regional, and national actions. We must reinforce our collaboration based on the international health regulations and under the WHO's guidance, including joint efforts to support the research and development of vaccines and to ensure access to medical supplies and equipment. The current situation underscores that the right to health must be an overarching principle as we design and implement public policies. Mexico is convinced that the respect to human rights must be an essential aspect of our response to the pandemic, not only for patients and their families, but also for doctors, nurses, and other health professionals. It is important that we ensure that the COVID-19 does not serve as an excuse for racism or xenophobia, which often disproportionately affect the more vulnerable populations. We must also integrate a gender perspective in all our actions. Most countries have faced the challenge of having adequate, safe, and affordable medical equipment, which is difficult to obtain at this time due to an unprecedented demand and shortages in production, resulting from social distancing measures and trade-related measures. This is why the government of Mexico have submitted a draft resolution to the consideration of the General Assembly of the United Nations, with the main purpose of engaging in the UN system in ensuring fair, transparent, efficient, and timely global access to preventive tools, laboratory testing, essential medical supplies, medical products, vaccines, and other medical equipment needed to face the COVID-19 pandemic. The draft resolution calls for solidarity, highlights the importance of international collaboration, underscores that equitable access to health products is a global priority, and urges member states to immediately prevent speculation and other actions that may impede access to critical health products and medical equipment. Mexico thanks both the support and the valuable comments made by all G20 members to this text. It now has over 160 co-sponsors and has been placed under silence procedure. As we move forward, we need to continue working together to fully overcome this pandemic and to work to strengthen preparedness, prevention, early detection, and response capacities to future health threats based on the principles of equity, sustainability, and social inclusion. The current pandemic has demanded special attention and efforts from national health systems and the international community as a whole. But there are other main issues within the global health agenda that need to continue being discussed. That is the case of the priorities set by the Saudi G20 presidency: value-based healthcare, digital health, patient safety, and antimicrobial resistance. We commend our Saudi colleagues for their leadership and hard work. Value-based health care is an important tool to provide access to health through person-centered health system perspective. We recognize the work undertaken so far to advance this concept, which is intrinsically related to the moment we are living. Digital health has the potential to transform health systems to enhance social and economic benefits. The 2030 agenda highlights the need to significantly increase access to accurate and reliable health-related information and communication technologies. However, for these schemes to be truly useful, they need to be accessible to all, especially the most vulnerable people who often lack access to both quality healthcare and new technologies. Again, a focus of social inclusion and the mainstream of gender perspective should be at the core of these efforts. Patient safety is a large and growing global public health challenge and concern. However, global actions to reduce the burden of patient harm have substantially changed. We need to reassert our commitment to improve patient safety as a main component as we push to strengthen health systems to provide access to quality healthcare services, particularly in primary healthcare. Since the adoption of the WHO's Global Health Assembly of the Antimicrobial Resistant Action Plan in 2015, there have been some important advances. but we need to intensify our efforts to achieve the objectives that we established at the national and global levels. International cooperation and multisectorial action continue playing a key role in the strategy against AMR because of its multifactorial causes. Dear colleagues, I conclude by recalling G20 leaders' statement. Quote, "The unprecedented COVID pandemic is a powerful reminder of our interconnectedness and vulnerabilities. The virus respects no borders. Combating this pandemic calls for a transparent, robust, coordinated, large-scale and science-based global response in the spirit of solidarity. We're strongly committed to presenting a united front against this common threat." Unquote. It is us in this virtual meeting who have a central responsibility in fulfilling this mandate. Mexico believes that the statement we will be adopting today is a valuable step in this direction. Let us continue the work to meet the needs of our populations through truly effective international collaboration. Thank you.
Thank you. Republic of Korea, the floor is yours.
Honorable Chair, Excellencies, distinguished delegates, it is very nice to meet all of you on this teleconference. I would like to begin by sending my condolences to those who have lost their lives to COVID-19 and their families. And I would like to thank all health ministers here for their tireless efforts to fight against the virus. Fighting against the COVID-19 crisis, Korea has developed a new infectious disease response mechanism, which is fit for the democratic country based on globalization and pluralization. Adhering to the principles of openness and transparency, the Korean government has made relevant information available in a transparent and prompt manner through briefings given twice a day. And our people, with trust in the government, strive to comply with primary infection prevention, such as practicing personal hygiene and strong physical distancing. Korea has ensured cross-border movement to the maximum extent while preventing the spread caused by the flow of the virus across borders. To do so, we have implemented special entry procedures, prohibition of departure of close contacts for 14 days, and 14 days self-quarantine for all inbound travelers. Korea has also utilized creative cutting-edge technology. For example, drive-through and walk-through screening stations were set to collect samples in a rapid and safe manner. And furthermore, IT enabled self-diagnosis and self-quarantine applications were deployed as well. Now, Korea is preparing for a possible second wave of COVID-19 infections, and at the same time, trying to cooperate on developing our collective actions to combat the pandemic as our leaders requested at the G20 summit. Many countries which are going through COVID-19 expect G20 countries to share its response policies and the lessons learned during the crisis. I hope the national best practices and urgent actions suggested by G20 to be substantially helpful for countries with vulnerable health systems, as well as every country which is responding to the COVID-19 crisis. Furthermore, we have to bolster cooperation on development of treatments and vaccines, and improve the access to those medicines. Korea is conducting a cohort clinical study with WHO's participation and also makes COVID-19 research data public to utilize them with the international community. Korea will join global clinical research for vaccines while expanding its financial contribution to CEPI and the Gavi, the Vaccine Alliance. Korea will continuously share quarantine experiences and clinical data and work together with the international community in efforts to develop vaccines. Meanwhile, despite adverse effects of COVID-19 on the world economy, the international community should continue cooperation. In this sense, the Korean government is committed to ensuring the supply of COVID-19 testing kits to those countries in need and also considering ways to expand humanitarian support. Korea will enhance collaboration to provide vital medical supplies to those in need in a timely manner. In order to effectively respond to pandemics such as COVID-19, I hope that G20 member states work together to develop additional measures for cooperation on strengthening infection control capacities, nurturing health professionals, and sharing relevant technologies. Next, I would like to briefly comment on value-based healthcare. As we are faced with common challenges of increased demand for medical services and the rising costs, it is crucial to discuss the effectiveness of the health system and their cost management. In this context, it is very meaningful to include that matter in the G20 Health Ministerial Declaration. Korea endorses the establishment of a global innovation hub for improving value in health by the G20 and will take part in, however, to share Korea's practices and to contribute to discussions on improving the value of our health system. The international community is struggling with COVID-19. Against this backdrop, I hope this crisis to serve as an opportunity to show our G20 collective response capacities and strengthen our collaboration. Thank you for your listening.
Thank you. Russia, the floor is yours.
Distinguished Minister, excellent colleagues, on behalf of Ministry of Health of the Russian Federation and on my own behalf, I would like to welcome you to this summit of the G20 health ministers. The current G20 summit is taking place at a very difficult time when the biological threat is testing the strength of our country's health system. And dear colleagues, I will tell, life is go on. Today is Orthodox Easter, so I take this opportunity to congratulate everyone who celebrates this holiday. And next my presentation on the Russian language, and my colleagues help me with translation, please.
Today, the exchange of national experience is crucial on all the negative consequences of COVID-19. And this very situation, the crucial role of WHO is of crucial importance. Let me thank the Saudi Arabia for presiding this meeting, and all the participants that provided us with our national experience for responding COVID. Russian Federation has stable health system. this is one of the priority direction of development of our country. Due to the pandemic in the world, in our country, all the necessary measures took place for preventing the spread of new coronavirus infection. In January, the national plan for response for COVID was endorsed. That included a vast spectrum of measures for reacting at national, regional and local levels. The Government Coordination Committee was created, and it is chaired by the Prime Minister. And special working groups were also created that included all the regions and involved them to the reaction. And special mechanism for making the speedy endorsement of civil acts was incorporated. Core elements for pandemic responding in Russian Federation is a strong surveillance system with a strong laboratory potential. Our health system has a strong hospital base. And a system for prevention. Today, every patient with COVID is under the surveillance of federal specialists and have all necessary treatment. National insurance system let us not think about how to cover the expenses. Today in the Russian Federation, the special center for consulting the patients for COVID is created. Russian special tests and recommendations are elaborated. All the time we are studying the experience of other countries for tackling COVID-19. Many things we apply in our current practice. The situation with COVID led us to think about the modernization of health system for tackling such threats. One of the actual issues is introducing the digital technologies. It is the surveillance of therapy and the results of treatment. Be that diagnostics with computer tomography and other methods. We see the great importance of telemedicine. it is important to follow and to continue the work of WHO for ameliorating the compendiums for digital health. As to the security of and safety of patients, we medical personnel. To conclude, I would like to mention three things. First, we should support the efforts of the WHO. Second, we should today think about the amelioration of mechanism for reacting of infectious threats. And the third issue is the provision of medical products, including making closer the regulatory mechanisms and control of quality of medical products. Thank you very much.
Thank you. South Africa, the floor is yours. Okay, it seems South Africa is not connected. Now, Turkey, the floor is yours.
Thank you, Excellencies, Director General, distinguished participants. Before I start my speech, I would like to extend my condolences on behalf of my country for everyone who lost their lives due to COVID-19. We are all struggling to absorb the unfolding shock, the fundamental and drastic shifts at our daily lives, and the fear that the worst may still yet to come, especially in the developing world and countries. We should not forget our responsibilities as G20 for the rest of the world. I thank Saudi Arabia for organizing such a timely virtual meeting in these unprecedented conditions. I wish a successful meeting for all. Distinguished participants, the Saudi Arabian G20 presidency wisely selected 3 priorities and pursued 2 critical topics. Each one of them are substantial. I believe that proposal of establishing a digital health task force, value-based healthcare hub, and leaders group of patient safety under these priorities will result in profound contributions in their respective areas in terms of information and experience sharing. Turkey will actively participate to the works to be carried out in these platforms. Distinguished participants, one of the agenda items that has not changed since the inception of Health Agenda is the pandemic preparedness. We all experienced that this SMART initiative prepared us to do today's real-time exercises SARS-CoV-2 pandemic. My country has rapidly implemented the various preventive measures against COVID-19. A scientific board consisting of scientists from different medical areas established and convened for its first meeting on 10th of January, 2 months earlier from the diagnosis of the first case. The scientific board prepared guidelines on the management of pandemic. Clinical guidelines have been updated so many times according to our national experiences and the latest information gathered from all over the world. Methods that are considered effective, such as flight bans and restrictions, border measures, internal travel restrictions, and curfew, were implemented effectively upon the recommendations of our scientific board. We put the utmost importance to surveillance and monitoring system. We traced 97.5% of all close contacts of suspected and confirmed cases, tested and isolated them. Thanks to our advanced health information system, we can easily track patients and its contacts online with a layered authorization. We increased our testing capacity to make sure that we detect cases as early as possible. Thanks to the Turkish Health Transformation Program ongoing since 2002, Turkey has a strong health system and a very advanced infrastructure. Many new and big hospitals built in this process by PPP model, having separate rooms for every patient and donated with the most advanced technology. Turkey also has a very high capacity of ICUs. In order to alleviate the economic burden resulting from the pandemic, opaque measures costing $15 billion was announced on the 7th day of diagnosis of first case. We also organized a public campaign to increase solidarity in our community to support the ones in need. I should say that all kinds of drugs used for treatment, tests for diagnosis, and protective equipment provided to public are completely free of charge in Turkey. Turkey is among the countries with the lowest fatality rate. We think the early treatment with hydroxychloroquine, favipiravir, and late intubation of patients may contribute to the result with good contact tracing and early detection of cases. Esteemed colleagues, the COVID-19 pandemic poses serious risk for countries with fragile health systems. Individual efforts of the countries put forward against the disease are valuable, but insufficient. We need much more international collaboration with much more responsibilities. With this understanding, Turkey, as usual, is putting all efforts to support more than 50 countries in need, most nowadays in terms of knowledge sharing and providing medical supplies. As being one of the most powerful structures, G20 should regulate its role and responsibilities in a solidarity perspective and intensify cooperation. I thank you.
Thank you. United Kingdom, the floor is yours.
I would like to start by saying a profound thanks to Saudi Arabia for hosting this meeting today, on behalf of both the British government and on behalf of my colleague, the Secretary of State. I cannot think of a more vital time for a health ministers meeting in recent memory. The UK highly values the G20 as a forum for sharing ideas and for forging commitments alongside and in support of other parts of the global health response, led by the WHO's crucial role as convener of the system.
Your Excellency, we are having difficulties in hearing you. Can you come closer to the mic, please?
The UK believes that in due course it will be important to review the response and to ask what all parts of the system, including relevant international organisations, and we ourselves have learnt for the next time. But for now, we are clear about the need to work together, and the UK advocates a strong global response supporting the WHO's strategic preparedness and response plan. Let me raise 5 subjects on behalf of the Government of the United Kingdom, which echo the words of others before me. Firstly, vaccines are key to long-term handling of COVID-19. The UK is particularly supportive of CP's work. We are also highly supportive of Galaxy, for which the UK will be hosting a replenishment in June. We encourage our fellow G20 members to contribute financially to both. Secondly, we are painfully aware of the danger of secondary impacts, which will be particularly devastating in the poorest countries. The UK is committed to supporting those who need it, including the implementation of the international health regulations and sustainably strengthening health systems. The necessity to maintain the flow of key supplies. We also welcome other key Saudi Arabia, all of which have an ongoing and increasing relevance to our climate. Let me emphasize three of them. Digital tools are crucial in addressing the pandemic. We look forward to further work in this area, as well as on improving interoperability and collaboration in other areas. Value-based healthcare and patient safety. We should all strive for excellent value and the best outcomes for patients. At a time when healthcare systems are under huge pressure, we must remember to consider the wider risks to patients beyond the immediate. Finally, AMR will be particularly relevant, including disrupted supply changes, forcing the use of antibiotics of a last resort. Overuse of antibiotics accelerating with and the tangible threat to COVID patients and secondary bacterial. My friends, we wish for more countries to review how they value and pay for antibiotics, incentivize increased pipeline of new antibiotics, and consensus on effective global governance to manage its pressures. We look forward to continuing this dialogue under future G20 presidencies. With thanks to the Chair. Thank you.
Thank you. United States, the floor is yours.
Thank you. Chair and fellow G20 members, the United States regrets the significant and ongoing loss of life from COVID-19 and has deep sympathy for the many families who have lost someone. We welcome the Saudi leadership in selecting this year's themes for the health track, but we regret that the United States, for many reasons, is not in a position to sign on to the ministerial declaration and urgent actions documents. For this reason, we will not be engaging in the later discussion of the documents. We instead urge the Chair to develop a short Chair summary that captures our work together and our joint resolve to defeat the pandemic. The pandemic massively challenges the health infrastructure of all countries experiencing it. It is exposing basic weaknesses, but also opportunities for improvements to our systems. Each of us must learn from the pandemic by innovating, and not only for therapeutics and vaccines, but also the use of PPE, hospital management, treating patients, as well as how to get back to work safely. We must become more resilient to future shocks. I congratulate the Saudi presidency for its 5 health track themes. Each represents key opportunities for learning and improvement. Due to the renewed awareness of the destructive power of pandemics to economies and societies, countries are much more willing to invest in public health to fend off future threats. Health and finance ministers are closer now than ever. Collaborations between governments and the private sector are proving indispensable for research, development, and production of new diagnostics, vaccines, and therapeutics. Public-private partnerships offer the chance to harness whole-of-society responses to the health challenges we all face. The next pandemic may happen sooner than we think. We need to break the cycle of neglect and subsequent panic once and for all. Patient safety is front and center as much of the public learns for the first time or relearns basic infection prevention and control through proper hygiene and physical distancing. Healthcare workers are optimizing protocols for engaging COVID-19 patients while protecting themselves and other patients. There's greater awareness of the dangers of antimicrobial resistance as patients on ventilators for long periods of time risk secondary bacterial infections. We all need to worry about the increased use or overuse of medically important antibiotics. Digital health is at the forefront of innovative responses to the pandemic by leveraging the use of telehealth and telemedicine. And advancing telehealth and telemedicine is an important project to me personally here at the Department of Health and Human Services, developing remote patient monitoring technology and new mobile apps for disease surveillance, prevention, and control, and driving new collections and uses of data to make more accurate and longer-term predictions of future health threats. The the necessity of maximizing the capacity of systems to develop COVID-19 related care is driving broader considerations of increasing value-based care and driving effective, efficient care. We now have a better understanding of optimizing care in outpatient settings, conserving supplies, expanding the roles of healthcare workers, and capitalizing on and institutionalizing public-private partnerships. This year will be remembered for many hardships and loss of life, but I hope this year will also be remembered for a significant leap forward in healthcare globally for the benefit of future generations. We appreciate the opportunity to collaborate on these vital issues and look forward to working with all of you to protect the health and well-being of all our citizens. On behalf of the United States government, thank you for allowing me to participate and for your attention. And I will ask Dr. Alma Golden from USAID to make a short remark.
Thank you very much. I want to first of all express my appreciation to His Excellency, Dr. Al-Rabaya, for his leadership on digital technology. Health information technology enables breakthroughs in patient care quality and innovation while strengthening accountability, efficiency, data collection, and analysis. That is necessary to recognize and respond to health conditions, trends, effective interventions, surveillance, and research. Digital health must also respect privacy and security of patients, families, health centers, networks, and nations while improving safety and value in this innovative framework. Digital health must assure the integrity of patient-level as well as system-level data, adhering to the highest internet standards for privacy, security, and access. The capacity to collect and analyze data in real time will inform both pandemic responses and ongoing health issues, resulting in the rapid recognition of best practices and improved coordination both in countries and across nations. Thank you very much.
Thank you.
Thank you. And now we proceed to guest countries, starting with Jordan. The floor is yours.
Okay. Mr. Chairman, Your Excellencies, ladies and gentlemen, on behalf of the Minister, I would like to thank the G20 member states and Saudi Arabia presidency for inviting us to participate in this meeting. I would like to talk about our experience with COVID-19 crisis. Jordan has adopted a proactive approach in its management of the coronavirus crisis, as it closed the country's borders, controlled entry, and imposed a quarantine for all arrivals. We are one of the leading countries in taking precautionary and preventive measures regarding all arrivals to the kingdom. The government has reinforced the role of a national committee for epidemics and supported it to practice its mandate in defining the strategy for surveillance, patient management, public information, and health promotion, and providing appropriate solutions for the implementation of outbreak response. Additionally, to safeguard the health of the refugee population in Jordan, we have taken strict measures to prevent the spread of the virus in refugees camps, including deploying active surveillance teams with focus on case finding, testing, and contact tracing. Once a case of coronavirus was confirmed, the government started to take preventive measures in the kingdom, and that reached at the curfew. A curfew has been applied to the entire kingdom with the opportunity for citizens and residents to purchase basic goods within specific hours and within appropriate health conditions. Purchasing behavior of citizens reflects a healthy and civilized healthy awareness, with few exceptions do not constitute a significant percentage. Medical and therapeutic work was done by hospital specialists, combined by an official media that transmits the latest developments and the number of cases affected by the disease with the utmost transparency, and clarity. Jordan has dealt with the coronavirus in all its dimensions, which represented a wonderful, successful approach and model in managing the crisis. In Jordan, everyone, institutions, individuals, and citizens are keen to provide support and assistance. The national effort is coordinated, organized, and in the same direction, targeting shared goals. The citizens formed a very positive moral support that motivated the efforts of officials and institutions. Also, the armed forces and the security institutions, everyone has taken the behavior of collective work with team spirit and dealt with every need or assistance with the utmost kindness and decency. Jordan focuses on achieving a balance between protecting people and continuing the country's economic life, balancing short-term goals with long-term goals with priority given to protecting people's health. Mr. Chairman, Your Excellencies, I urge the G20 member state as well as international society to take quick actions to prepare for the battle against COVID-19 and ensure that no one is left behind. It is our moral obligation to consider strengthening health system globally and helping countries in most need to build its capacity to prepare, respond and contain the pandemic and protect people, especially the most vulnerable. Expanding manufacturing capacity to meet the increasing needs for medical supplies and ensure these are made available where they are most needed and as quickly as possible. Ensuring sufficient supplies of essential medical equipment for frontline health workers. Sharing timely and transparent information about the disease and exchanging epidemiological and clinical knowledge. Sharing national best practices on jointly combating the pandemic and experiences on case management and treatment protocols both for severe and mild cases. Sharing new technologies and strategies to contain the virus transmission. Supporting and strengthening the WHO mandate in coordinating the international fight against the pandemic, including the protection of frontline health workers, delivery of medical supplies, especially diagnostic tools, treatments, medicines, and vaccines, accelerating research and development. Thank you again for giving us the chance to be part of this event. We wish you also all success and prosperity. Thank you.
Thank you. Singapore is next.
Chairman, Excellencies, colleagues, good afternoon to all of you. First, I would like to thank the Kingdom of Saudi Arabia for convening this very important meeting. COVID-19 pandemic is an unprecedented crisis of a very complex nature. Many countries, including Singapore, have taken swift and decisive measures to contain the outbreak. In Singapore, we have mobilized the whole nation in our fight against COVID-19. We have set up a multi-ministry task force to coordinate our efforts on COVID-19 with ministerial representation from the various sectors. The strategy is to slow down the infection as much as possible and preserve our healthcare capacity. We conducted enhanced surveillance and testing, tightened our border controls, and mobilized the whole population to work with the government to practice safe distancing and a high level of personal hygiene. In recent weeks, we have seen a spike in the number of cases, with the majority of new cases involving foreign workers from dormitories. We have formed a special interagency task force with our senior minister as advisor to contain the spread and protect our foreign workers. Workers are being tested extensively. We have set up medical facilities in the dormitories to provide them with medical care and paying close attention to their needs and well-being. Our foreign workers play an important part in building Singapore, and we will do our best to take care of them. The pandemic has triggered many nations to shut their borders, limit exports, and halt economic activities, causing severe disruptions and creating uncertainties. The COVID-19 pandemic is likely to take some time to be resolved, maybe to the end of the year and beyond. But the impact on our economy and our society will last much longer. Singapore introduced a package of fiscal measures totaling $60 billion, equivalent to $42 billion US, or equivalent to 12% of our GDP, to cushion the impact. These measures help support workers and protect their livelihoods, help enterprises overcome immediate challenges, and strengthen economic and social resilience so that we can emerge stronger. Our societies have to adjust and adapt to the new normal. As leaders, we need to strengthen solidarity and forge a resilient society to help the vulnerable among us so that no one is left behind. Our healthcare and frontline workers have been working around the clock to care for our patients. I would like to thank them for their dedication and commitment. We are also heartened to see the whole nation united under the SG United initiative, where individuals and organizations are volunteering, donating, supporting our efforts, and helping the needy among us. No country can fight the virus alone. Therefore, countries should share experience and expertise, embrace strong international cooperation, particularly in research and vaccine development. The virus will not be truly contained anywhere unless it is effectively contained everywhere. The actions we collectively take today can and will determine the course of the disease globally. Now is the time for unity, for the international community to work together, solidarity to stop this virus. Beyond COVID-19, we must also collaborate globally and share ideas on many important health issues and challenges to deliver better health for our people. Singapore is grateful to be part of this important discussion, and I look forward to working closely with the G20, WHO, and the wider international community.
Okay. Thank you. Spain, the floor is yours.
Thank you, Chair. Please let me speak on behalf of Minister Illa, in which name I would like to begin by thanking the work of the Saudi Presidency for its work, valuable documents, side events, and its adaptation capacity to adapt the work of the G20 Health Group to the COVID pandemic. The urgent action and good practices documents will be very useful in the near future. We should learn from COVID-19 much more on international and multisectorial cooperation to approach pandemic from all perspectives, as well as the need of solid international institutions that can provide us with solid data, clear evidence-based recommendations, and predictive models to protect public health. We appreciate all the efforts and work done by WHO and the EU for that purpose. Spain supports the initiative for value-based healthcare and its potential for transformation, while it focuses on equity with a patient-centered approach and trained and skilled professionals. We have to preserve health system accessible with primary care and its cornerstone, while ensuring access to prevention, health promotion, and sexual and reproductive health services. It is also important to guarantee resilient health systems to achieve universal health coverage and to better face extraordinary events like COVID pandemic. COVID pandemic is showing the need to strengthen patient safety at all levels. Digital health key to make more resilient systems and will allow us to better handling the actual COVID and future crises. We must protect the privacy, intimacy, and individual freedom when using such technologies in the field of health. I want to express Spain's commitments on MER and reiterate the importance of combating the global threat through One Health approach. COVID has challenged our national health systems. The ongoing research will provide evidence and additional data for better preparedness for future pandemics. In this COVID framework, it is important to highlight the great collaboration of all actors involved. All the lessons learned during this crisis are to be incorporated in our standard procedures and will help address any further challenge that may arise in the future. Thank you.
Thank you. Switzerland, the floor is yours.
First, I would like to express my gratitude to the Kingdom of Saudi Arabia for inviting Switzerland to participate in this virtual G20 health ministerial meeting. I think this pandemic is an unprecedented threat for all our countries, and we can only effectively fight it by working together. In Switzerland, I just want to highlight 4 elements of our response to the crisis. We had to precise for 2 years ago to precise the legal framework, and we have now a clear legal framework. I can tell you it is a notorious performance in a federalist country. Secondly, we put in place rapidly several crisis management boards involving different parts of the administration in and outside the health sector, and also with the public and the private sector. Third point, we increased the health system capacities substantially, especially for intensive care units. And 4, we invested a lot in communication, because it is important to make people understand the decisions and to make them help in the implementation, especially of hygiene and social distancing measures. I wanted also to mention here that in this context, it is for us crucial to ensure UHC in emergencies and guarantee the continuum of care, also where the health systems are weak, so that the health needs of the population can be met for COVID-19 and beyond. And in this difficult situation, international cooperation, international collaboration, solidarity are absolutely crucial at bilateral, but also at regional and global level. And we can count on solid international organizations. We have also in Switzerland the WHO, and I think the WHO is a very important organization facing this issue, with a central role in guiding us through these uncertain times and coordinating the international response. And I think we need the expertise, we need the instruments of the WHO and other international organizations, from the UN family to CEPI or Gavi, each according to its mandates. And in turn, these organizations need our support, especially in terms of sustainable financing. There will be a time to look back and draw lessons learned, but as we are amidst the fight against COVID-19, we should concentrate on this. Let me, Chair, finish by saying a few words about a very important issue also for Switzerland. And let me remember that Switzerland will host the next global ministerial summit on patient safety. It had to be postponed in view of the COVID-19 situation, but we remain strongly committed to international collaboration on patient safety, and we will communicate a new date for this summit in due time. And we appreciate the initiative of creating a patient safety leaders group and are looking forward to working with this group also for this summit. And finally, I would like to express again, one more time, our support for the work of the Global AMR R&D Hub. Thank you very much.
Thank you. And now we proceed to regional organizations represented by countries. Rwanda, the floor is yours. We move now to Vietnam. The floor is yours.
Thank you. Mr. Chair, Excellencies, ladies and gentlemen, let me start by thanking Saudi Arabia for hosting this important meeting. The COVID-19 pandemic is a global human tragedy. The G20 leaders at their extraordinary G20 Leaders Summit in March 26, 2020 committed to work together in solidarity to provide the necessary political momentum. Much has been made for the containment effort in Vietnam. The National Steering Committee to prevent and combat the COVID-19 has been set up at the early stage of the outbreak with a strong commitment from the whole system in line with the government's directive and awareness-raising effort to increase public engagement. All instructions of the party, government and authority have well resonated among people and multi-sectoral communication and collaboration are strengthened. The government appeals the calls for the national unity against COVID-19 and deploys warlike symbolism in fighting with COVID-19. Vietnam has been applied 4 strategies: preventions, early detections, isolation and treatment, engaging local authority to direct and mobilize all resources inside, including commands, forces, means and logistics. Measure has been taken to manage, control and limit the spread of the disease, such as early isolation for the suspected area, mass testing for everyone coming from affected area and epicenters, social distancing, etc. We have actively collaborated with multi-sectoral partners to improve testing, research, investigation and treatment protocol for the most effective outcome despite limited resources. A health app was introduced, serving as an official channel to disseminate the epidemic situation as well as health recommendations to citizens. From the economic and social perspective, the government incentives have been issued to mitigate the impact of the COVID-19, including tax break, permission for the late payment of taxes, and deferment of land use fees for businesses, while simultaneously offering many policies to support businesses, investors, small traders, and the people. Vietnam adopted a dual approach of containing and controlling the outbreak while sustaining socio-economic stability, fending off the disruptions. Immediate action has been taken to help people facing hardship, particularly the vulnerable, the poor and worker, making sure that no one is left behind. As a role of status of Vietnam as the current chair of ASEAN, as a non-permanent member of the United Nations Security Council, Vietnam has also made effort to raise the coherent response to the epidemic. A cross-sectoral ASEAN working group involving the senior officials on health, foreign affairs, information, defense, immigration and transport was established with a view to developing a regional holistic response to the pandemic. Some practical measures are in agreement to ensure information exchange and policy coordination among member states, strengthening ASEAN's response capacity to public health emergencies, setting up regional medical stockpile, and developing an ASEAN pandemic support fund. Excellency, ladies and gentlemen, we are working together to provide a collective response. We absolutely go along with the proposed call to action to the G20. First and foremost, Vietnam call for further strengthening COVID-19 and addressing common challenges for the peace and stability in the region and in the world. For research and development, Vietnam supports development of the appropriate coordination mechanism to ensure equitable and affordable access to the new products for all countries and populations. Finally, the international health regulation capacities should be accelerated, including surveillance, risk assessments, laboratories, infection prevention and clinical management, risk communication, etc., especially for countries with a weaker health system. I wish you all great success. Thank you very much.
Thank you. Thank you. United Arab Emirates, the floor is yours.
Thank you, Mr. Chairman. Dear Excellency Dr. Tawfiq Al-Rabi'a, Chairman of the meeting, let me start by thanking the Kingdom of Saudi Arabia for inviting us to participate in this important meeting. Excellencies, we meet today in a distressing situation that calls for swift and exceptional actions. COVID-19 has revealed the necessity for national and global preparedness and a coordinated response to meet such situations. UAE has an integrated state-level emergency system designed to have a high of preparedness and response for all types of emergencies. With this emergence of a viral epidemic being ranked as #1 in the country risk registry, in order to contain the COVID-19 outbreak, we established a robust surveillance mechanism based on a mass screening, diversification of service delivery channels, and timely sharing of information. Up until now, the United Arab Emirates has conducted more than 800,000 PCR tests and continues to conduct around more than 20,000 tests daily for high-risk segment of population. Nationwide, all COVID-19 positive cases have either been isolated or hospitalized. We have upscaled our capacity to respond to this pandemic through the establishment of dedicated hospital and isolation centers. Ladies and gentlemen, countries need to have the necessary infrastructure, essential medical and human resources to combat COVID-19. Cooperation and collaboration between different sectors within the countries and solidarity between different countries are the key to combating this pandemic and other to come. Therefore, we strongly support the G20's emphasis on the importance of pandemic preparedness and the need to reinforce and strengthen national healthcare system and public health capacities for early warning responses. In addition to this, we also support the other G20 health priorities for this year and endorse the establishment of Hub of Improving Value in Health, a G20 Digital Health Task Force, and a Global Patient Safety Leaders Group with an aim to exchange expatriates of foster innovation. Ladies and gentlemen, COVID-19 has challenged the health system in our countries, as well as our ability to coordinate to achieve global health security. Let us come out of this crisis more united in our effort than before. Thank you, Mr. Chairman.
Thank you. Rwanda, the floor is yours.
Thank you, Chair. Excellency, the Minister of Health, the Kingdom of Saudi Arabia, Chair of the Ministerial G20 meeting, Excellency, Head of International Organization, colleagues, Minister of Health. Since the beginning of the ongoing outbreak and the WHO declaration of COVID-19 as pandemic, Rwanda and Africa set up strategies to prevent and mitigate the pandemic in collaboration with WHO and other bilateral and multilateral partners stakeholders. 2 weeks ago, the African Union President, His Excellency President Ramaphosa, organized a video conference with 7 heads of states, and the Director General of WHO attended as well with the President of France. From their discussion, it appeared that a well-coordinated response to COVID-19 was required to mobilize resources for comprehensive intervention against COVID-19. Thus, 4 experts from Africa are now designated to ensure adequate mobilization of domestic and international resources for effective and efficient response against COVID-19. The Republic of Rwanda and many other countries in Africa developed COVID-19 preparedness and response plan aiming to enhance the capacity and the capability to prevent, timely detect, and effectively respond to COVID-19. These plans were endorsed by WHO Regional Office in Africa and therefore integrated in WHO Strategic Preparedness and Response Plan. The existence of WHO Strategic Preparedness and Response Plan serves to faster respond to COVID-19 pandemic especially in countries with vulnerable health systems. Today, experts from WHO and bilateral partners such as CDC USA are supporting African countries to implement the response plan for COVID-19. Rwanda established a joint command post composed by multi-sectoral and multidisciplinary stakeholders. A national incident management system is also set to respond to COVID-19 outbreak. Regarding the magnitude and potential long-term consequence of COVID-19 to health system, there is a need for international solidarity to assist in availing high needed emergency supplies for preventing the spread of COVID-19, essential medical commodities and drugs, and strong improvement in management of health supply chain and human resources, especially health workers at the front line of this management of outbreak COVID-19. This will allow continuity and accessibility of healthcare services for the population in the perspective of building a resilient health system against health emergencies like COVID-19 and other future pandemics. There is a need for global solidarity to support African countries to mitigate socioeconomic impact due to the confinement strategy to contain COVID-19. We appreciate the recent financial commitment from international funding organizations such as the World Bank, IMF, the Global Fund, and others to African countries. However, there is a need for additional resources to respond to the consequence of this pandemic. We hope that our joint effort will contain this ongoing global threats and return to normal situation. I thank you, Excellencies.
Thank you. Now we move to international organizations. Gavi, the floor is yours.
Dear Excellencies, ladies and gentlemen, thank you all for inviting me to join you. As you know, Gavi, the Vaccine Alliance, currently helps countries vaccinate nearly half of the world's children and has introduced 496 new vaccines for a wide range of infectious and epidemic diseases and low and middle income countries. Such vaccinations play a huge cost-effective role in helping to maintain global health security and economic stability. But it is only perhaps during these extraordinary times that the world is coming to fully appreciate the needs for vaccines. It's now clear if we want to end this pandemic, minimize loss of life, and return to some semblance of normality, that we need vaccines, and as I will explain, not just COVID vaccines. I thank the G20 Extraordinary Leaders Summit as they committed to support the vaccine effort through WHO, Gavi, and CEPI, and the Kingdom of Saudi Arabia for its leadership and pledge of $150 million to Gavi last week to tackle COVID-19, and also to Japan and Minister Kato for your generous contribution of $100 million during this call. With more than 100 COVID-19 vaccine candidates being developed, the response from the scientific community and industry has been unprecedented. But of course, vaccine development on its own isn't enough. In addition to the enormous task of developing COVID-19 vaccines to fruition, we face 5 critical challenges if we are to end the pandemic. The first is to ensure that there are enough vaccines for everyone. We need global leadership to prioritize vaccine candidates and to ensure that manufacturing capacity is in place to produce enough doses. The same global leadership will be required for the second challenge, to guarantee that there is equal access to these vaccines. We cannot have a repeat of the 2009 H1N1 vaccine where there was not enough supply for developing countries. The third challenge is deployment. Getting billions of doses of vaccines out to the entire world efficiently is a complex task. Gavi has tremendous experience with new vaccine introductions like the Ebola vaccines during the recent epidemic in the Democratic Republic of the Congo. We currently supply 600 million vaccine doses per year. consideration will need to be given as to whether we think about pooled procurement through Gavi for non-Gavi eligible middle-income countries as well. The fourth challenge is also to ensure we do everything in our power to protect healthcare workers and bolster health systems. To this end, Gavi has made a first tranche of US $200 million available to protect healthcare workers with personal protective equipment, perform vital surveillance and training, and fund diagnostic tests. The fifth challenge also includes ensuring that routine immunization continues during the pandemic. Disruptions to immunization have already led to 13.5 million people in Gavi-supported countries missing out. It is estimated that for every COVID-19 death averted by not continuing routine immunization, this will lead to an estimated tragic 128 deaths from other diseases. We need to be prepared to work with countries to do catch-ups when possible, as we did in West Africa post-Ebola, as soon as the lockdowns are relaxed. Otherwise, outbreaks of measles, polio, yellow fever, and others will be inevitable. Furthermore, if we allow routine immunization programs to collapse during the pandemic, the deployment of COVID-19 vaccines will be next to impossible, as they provide the core infrastructure for distributing them. This makes the work that we're doing more important than ever. As you know, on June 4th, the government of the UK will be chairing Gavi's Global Vaccine Summit, where we hope to secure at least $7.4 billion for the next 5-year period. We need this to continue to immunize at least an additional 300 million children and prevent 8 million deaths. This was always an ambitious target, but it's more so today. But we must do this if we are to protect the world from disease. Supporting the manufacturing, procurement, and timely delivery of COVID-19 vaccines globally will cost more. Our current estimates are $4 to $8.5 billion required for the next 2 years to prepare manufacturing at scale in countries for distribution. Given the cost to the global economy, aside from the huge social disruption and tragic loss of life we've already seen, this may be the best investment in prevention any of us has ever made. Excellencies, Gavi and the alliance partners need your support and your leadership to maintain our ability to keep the world safe from preventable disease. We stand ready to use our unique position across the vaccine supply chain to play a lead role in a coordinated global response to COVID-19, because it's only by working together that we can truly end this pandemic. Thank you, Mr. Chair.
Thank you. Now, the Global Fund, the floor is yours.
Thank you, Mr. Chairman. And thank you, Your Excellencies. As Executive Director of the Global Fund to fight AIDS, tuberculosis, and malaria, I want to briefly stress 3 points. First is the urgency of providing rapid and substantial assistance to the more vulnerable countries and communities in the world, particularly in Africa and particularly in those places afflicted by conflict. The combination of weak health systems, the high burden of other infectious diseases, low economic resilience, both at a household level and a national level, and limited access to COVID-19 commodities, means that COVID-19 could, over the course of the next few months, cause huge loss of life, both directly and, building on Seth Berkley's comments from Gavi, indirectly. Indeed, at the Global Fund, we are already seeing alarming signs of significant disruption to ongoing HIV, TB, and malaria programs as a result of COVID-19. Given that these 3 diseases still kill 2.7 million people a year, half the number of a decade ago, but still far too many, we cannot afford to slip back on these diseases. And we see a real risk that the indirect death toll from COVID-19 could be as large or larger than the direct toll. Second, the Global Fund is absolutely committed to playing its part in the global COVID-19 response, leveraging its proven model of partnering with implementer governments and communities, with other development partners, and making the most of the infrastructure and capacities we have helped countries put in place to fight HIV, TB, and malaria, to accelerate and strengthen the response to COVID-19. A good example is using instruments put in place for TB diagnosis and HIV viral load testing for COVID-19 diagnosis. Since the beginning of March, the Global Fund has provided 61 countries with financial support on COVID-19. And we have now launched a second support mechanism that will bring our total financial support on COVID-19 and to the adaptation of HIV, TB, and malaria programs to the new environment caused by COVID-19 to up to $1 billion. However, going back to my first point, I anticipate that we will have deployed all these financial resources in a matter of weeks. If the world wants to prevent a disaster unfolding in Africa and among the other more vulnerable places of the world, much more will be required. My third and final point is to simply underscore the importance of engaging communities and civil society in the response to COVID-19. If there's one thing we have learned from the fight against HIV, TB, and malaria, and more recently in the response to outbreaks such as Ebola, it's not just engagement of community that is required, it is community leadership. We need the scientific tools, we need the money, but we also need the engagement and leadership of those directly affected. Your Excellencies, the Global Fund was created in 2002 to fight the last massive pandemic strike humanity, HIV/AIDS, a disease that has killed 32 million people, a disease we still have no vaccine for, nor cure, but that we have managed to effectively eliminate as a public health threat in many parts of the world. The Global Fund is committed to playing our part in confronting and defeating the challenge of COVID-19. Thank you.
Thank you. The Islamic Development Bank, the floor is yours.
Now is okay?
Yes.
Can you hear me?
Yes, we can hear you.
Thank you.
Please go ahead.
Thank you, Your Excellency. I would like to express my gratitude and appreciation to the Saudi Presidency for inviting the Islamic Development Bank to be part of the Health Working Group and the Health Ministers' meetings. Health has been one of the priority sectors for the Islamic Development Bank. Since the inception, the Islamic Development Bank, the health sector has accounted for more than $4 billion of the ISDB intervention in its member countries through various modes of financing. As of today, 54 of our member countries has been affected by COVID-19. Obviously, the pandemic affected not only the health sector, but also the aspect of the socio-economic development. The ISDB group has now approved its $2.3 billion 3 R's respond, restore, and restart package to help fund member countries' effort to mitigate the socio-economic impact of the pandemic. The package deploys grants, concessional resources, trade finance, private sector lending, and political and risk insurance coverage. Accordingly, the bank has already committed a package of $663 million to support countries including Kyrgyzstan, Mauritania, Senegal, Sudan, Tunisia, Uzbekistan, to overcome the COVID-19. Moreover, a call for innovation was launched by the $500 million ISDB Transform Fund to support our member countries' preparedness and response to the pandemic. ISDB also has partnered with the World Academy of Science to promote and support quick response research on the key challenges related to the COVID-19 pandemic and the possible consequences. The ISDB UNCLOS Joint Research and Technology Transfer Grant Program is funded by the ISDB and established to develop collaboration between researchers in the ISDB member countries. It is worth mentioning that the ISDB health policy under the theme Affordable Quality Health Care for Human Development has 6 core principles, including strengthening primary health care for universal health coverage based on the Islamic concept of health. This concept serves as a reasonable drive and justification for the G20 value-based health care, patient safety, AMR, a priority for the G20 health agenda, aiming to develop person-centered health system that can provide sustainable universal health coverage in G20 countries and beyond. I would like to take the opportunity to call for more collaboration between G20 member countries and key partners to further support the efforts of poor countries to comfort this pandemic. Thank you. Thank you so much.
Thank you. Now, the International Telecommunication Union, the floor is yours.
Okay, thank you. Mr. Chairman, can you hear me?
Yes.
Okay, great. Thank you, Excellency. Thank you to invite IETU to join this meeting. I also like to take this opportunity to present my congratulations and appreciation to all the Excellencies, Minister of Health of G20 members and guest country members to this important challenge and to take care of the public safety and health of our population. IETU, as you know, International Telecommunication Union, is a specialized agency of the United Nations, established in 1865. We have 193 member states, but we also have more than 900 ICT companies, industries with us. So over the last 150 years, we worked very hard for new technologies of communication, starting from telegraph, telephone, then data, satellite, and mobile. You know that today we have mobile communications, big data, cloud computing, and artificial intelligence. But we are not only working with our experts, though. We also worked with many sister organizations and ecosystems, particularly with our health experts. And already for two decades, when we started to introduce mobile technology into the public, we worked with WHO, with health experts to talk about electromagnetic effect to the public health. And since then, we worked very hard to develop teleworking for medical service, telemedicine, e-health, and during the Ebola period, we worked with our operators, authorities to develop a toolkit to help the population to fight against this one disease. And recently, we launched e-mobile health, and artificial intelligence for good health focus group to have this kind of joint efforts to improve the health system. So we are working very hard with them. I'm very pleased that during your preparation of this meeting, we found a lot of recognition of digital health, and you invite IETU to join your task force, and we surely we will try our best to contribute. And I also would like to advise you that IETU, together with industry members, worked very hard already for many projects such as ICT tools to help disabled people, ICT tools to help aged people. So all this, I think that we will continue. So we will very much like to contribute to your efforts. And to conclude my short interventions, I would also like to advise you that my brother, Dr. Tedros, DG of WHO, when he started his mandate, I invited him to join my United Nations Broadband Commission for Sustainable Development, and he was very pleased to join us, and he guided and encouraged our commissioners to develop guidelines for pandemic, for health issues. So I think that this kind of effort will be continued. And of course, I'd like to just conclude my short introduction by highlighting two things. We're talking about the digital health. We're talking about e-health. But all this means those people are connected could profit. But according to our statistics, we still have half population not connected online yet. So how can we bring these people, not left anybody behind? That is a challenge. And last point, I think that we should all mobilize our SMEs to help us, because SMEs know technologies, they know challenges, and they can develop local applications, local solutions to help us. So that is my short intervention, and I would like to once more again thank you for your kind invitation and assure you that the ITU and its members, in particular industry members, would like to contribute to your efforts. Thank you.
Thank you. Now, OECD, the floor is yours.
Mr. Chairman, dear ministers, it is a pleasure to join you as Secretary General of Hungary and work with the Saudi presidency is very, very important agenda. Let me first commend the work that you and the WHO are all doing to fight the pandemic. It is an really effort. I also want to pay tribute to your health workers, particularly those who have died saving lives. There are 3 areas where the OECD
we are having difficulty hearing you. We'll go to the next organization and come back to you. Okay?
Okay. You can hear me? Now.
This kind of difficulty hearing you. We'll come back to you.
Okay.
Now we have UNICEF. The floor is yours.
Excellencies, COVID is not a children's disease. In spite of that, we see the world's children becoming hugely affected by their education, their protection, and the effects of poverty, now and into the future. In the health sector, we see reduced access to health services from lockdowns or from fear of seeking care. And we see disruption of health service provision for lack of protective equipment, for lack of drugs and supplies, and in some places from health services being overburdened by COVID patients. Our projections foresee child death increasing by the hundreds of thousands from these service disruptions, not from COVID, but from measles, from regular pneumonia, malaria, diarrhea, and more dangerous childbirth, leading to maternal as well as newborn deaths increasing by the hundreds of thousands. This is a children's rights crisis. UNICEF urges the G20 to mitigate the impact from COVID control measures on children's survival, health, and well-being. We ask you, the G20 members, to remember and honor your commitments to universal health coverage. UHC is key for health security. We ask you to practice equity and solidarity in the distribution of scarce supplies now and in future COVID drugs and vaccines when they come. We ask you to support health services preparedness with WASH. 1/4 of the world's health facilities still lack water. We need oxygen systems for the world's poor countries' health services. And we need to support communication and community engagements, which were key to stop the West Africa Ebola epidemic. In order to keep health services going worldwide, we need your support for maternal and child health as we tackle COVID. This is where the hundreds of thousands of lives can be saved by maintaining regular maternal and child health services, saved from the regular causes of mortality. We also ask your assistance in monitoring the collateral impacts on service provision and use and on mortality from the other main causes in the local context, and adjust COVID control measures such as lockdowns accordingly. And finally, we ask you to leave no one behind. The most vulnerable children, the migrants and the displaced that we have heard made reference to earlier, and to keep prioritizing ongoing emergencies from other causes. These other causes, be they earthquakes or tornadoes, do not pause for COVID. Excellencies, children are not just our most treasured assets, they are also the future of humanity. UNICEF works with country governments to protect them as we tackle this emergency globally together. As long as one country has COVID, all countries have COVID. Thank you.
Thank you. Now we go back to OECD. The floor is yours. OECD, we cannot hear you.
Now I'm unmute.
Okay.
Can you hear us?
Yes.
Okay.
OECD?
Yeah. Can you hear me now?
Yes, we do hear you.
Okay. Can you hear me?
Yes.
Hello? Can you hear me?
Yes, we do hear you. OECD?
We're in the lobby right now.
Yeah.
Okay, I think we need to move to United.
Hello?
United.
Yes.
We'll move to
Hello, it's United.
United.
Thank you, Your Excellencies, Mr. Chair, Dr. Tawfiq, Honorable Minister, dear colleagues. Many thanks for Saudi Arabia for this meeting and the invitation of United to participate in this ministerial G20 event this afternoon. United warmly welcomes the effort of G20 ministers to promote an ambitious and coordinated response to the COVID-19 pandemic. First, as Executive Director of United, I want to start to stress my support and the common vision expressed by my colleague of Gavi and the Global Fund. We certainly need vaccines against COVID-19, but they will not be ready for many months. We need also basic science to better understand how to defeat this virus. And right now, at least as soon as possible, we need new treatment and better and faster diagnostic to fight until we can control the coronavirus by the vaccine. And we need solution that works in low and middle income countries with weaker public health system. United is ready to take part and contribute to the development of new tests and medicine that can prevent and treat the coronavirus. United core business is to help to select and develop innovation to access and lead access to scale. We work in partnership with academia, North and South, PDP industry, WHO, Global Fund, UN partner, US bilateral and others. We are doing that for fighting AIDS and TB and malaria, and we have to do that all together to go now after COVID-19. My second point is for succeed, we need also to ensure equitable access to these new tools. We must create the condition to make sure that who needs them can access them in a timely manner. This condition should be discussed and defined since the beginning of the product development phase. Public money should lead to public commitment from industry. These tools have to be global goods and not reserved to the richest country. Global threats need global solution. We believe it's not the time to create a new institution, but rather to leverage the experience and the competence of existing organizations to ensure an efficient and coordination of the response. We are currently investing in diagnostic treatment and triage tools for respiratory disease in support to the global fight against COVID-19, in collaboration with WHO partners. Tools which are adapted and affordable for low-income countries, and thanks for the support of Brazil, France, Chile, Norway, Republic of Korea, Spain, UK, and also Japan, and the Bill and Melinda Gates Foundation. Third, and the last point, we have acquired specific know-how to address quality, price, and supply, to work and negotiate with industry, including on voluntary licensing together with the medicine patent pool created and funded by United. Billions of treatments are required to combat this pandemic. They need to be safe and available. We believe that there is a need to support by the leader of G20 the voluntary pool mechanisms and other mechanisms to face the challenge of access. We commend G20 leadership and vision in the fight against COVID-19. United stands to support G20 government and serve the people in need. Thank you.
Thank you. Now we go back to OECD. The floor is yours. Okay. We move now to the World Bank Group. The floor is yours.
Thank you, Your Excellency, Mr. Chair. And thank you, Honorable Ministers. On behalf of the World Bank, as Global Director for Health and the Global Financial Facility, I want to join the remarks by leaders from WHO and other multilateral institutions and international financial organizations in this forum. At the outset of this pandemic, the World Bank worked along with other agencies, including WHO, to develop a coherent approach to how we support countries. On March 17th, the World Bank's board approved the fast-track package of support for countries, announced $14 billion of support available for public and private sectors. And on April 2nd, our board approved the first sets of projects under an umbrella of $6 billion to enable member countries to stand up their emergency responses, strengthen their health systems, improve their national capacities for preparedness under the One Health approach, and also pursue community engagement and risk communication. That is within the framework of the strategic response plan that WHO provided. We recognize and thank the G20 countries as important shareholders of the World Bank for their support at the board and for enabling the rapid mobilization of resources through the World Bank. And on April 17th, the bank announced a Health Emergency Preparedness and Response Multi-Donor Trust Fund to complement the IDA and IBRD resources in support of countries. Here, we would like to acknowledge the strong leadership role of the government of Japan and others in helping advance this agenda forward. We recognize and appreciate the Saudi leadership in putting on the table the value-based healthcare, digital health, patient safety, and antimicrobial resistance. These are core parts of our ongoing HMP strategy, and we offer our support for the proposed hub and express our interest to join in supporting the arrangements alongside other organizations, WHO, OECD, Gavi, and others. We're working with CEPI and Gavi and others to advance the development of vaccines, diagnostics, and therapeutics for global access, and will continue to support countries to improve their service delivery infrastructure, their primary healthcare systems, and their hospital infrastructure. So once again, thank you very much for the opportunity to make these few remarks.
Thank you. Now we go back to OECD.
Thank you, Mr. Chairman. I hope you now can listen to us.
Yes, please.
I was just starting by commending the work that you and the WHO are all doing to fight the pandemic. It is an Herculean effort, and I also want to pay tribute to your health workforces, and particularly those that have died saving others. There are three areas where the OECD considers that international cooperation should be upscaled. First, we must know in real time what works and what doesn't, so we can upgrade our collective response. We put at your service our policy tracker of all G20 and OECD countries to support this effort, as well as our analytical capacities to help assess ex-post health systems resilience and preparedness. Second, cooperation is needed not just to develop a vaccine, as the Gavi DG mentioned, but also to ramp up vaccine production and delivery even before its final approval, changing existing product approval rules if necessary. Beyond the crisis, we really need to find better ways to pay for developing new vaccines. They are a global public good, as we know nowadays. Thirdly, universal access to quality healthcare is a right, not a privilege. It is an investment, as many of you have mentioned in this discussion. Our ILO, OECD, WHO Working for Health program is key to delivering on this, and we put it at your service. We also need to start working on strengthening our health system so this never happens again.
Implementing the G20 Saudi priorities is critically relevant, and the OECD has been supporting and working hard on each one of them. On digital health, we welcome the establishment of the Digital Health Task Force, and we will continue contributing to this important work. On value-based healthcare and patient safety, our patient-reported information survey, PARIS initiative, will help you shed light on how to make our health systems more people-centered. Finally, on antimicrobial resistance, we need to sort out once and for all. We have been discussing this for many years in the G20, the market incentive issues and the role of governments and the private sector. The way we pay for new vaccines and antimicrobials is not fit for purpose and puts our lives and our economies at risk. Mr. Chairman, our world is in deep health, economic, and social crisis and needs rebuild. The OECD was born to help reconstruct a new and better world from the ashes of the war. We stand ready again to help get through this crisis and recovery. Thank you very much.
Thank you. We have now concluded all statements. We appreciate your effective participation and your valuable statements. I also would like to thank our dedicated teams from all G20 members, invited countries, and regional and international organizations on their tremendous efforts and commitment during the health working groups, side events, and roundtables since the beginning of the presidency, and especially over the past few weeks following the COVID-19 outbreak. The presidency favorably recognizes the membership support to key outcomes on the health agenda, including value-based healthcare, digital health, patient safety, and AMR. On the other hand, it's very unfortunate that the G20 was not able to reach a consensus over the health minister's declaration in the midst of a global health crisis. In the spirit of solidarity, the presidency's choice is to avoid a 19+1 statement, and at the same time, we will not issue a chair's summary. The presidency will instead opt for a press release, and we will continue our discussions to conclude the declaration in the upcoming ministerial meeting. And now we would like to have a family photo. So please, each one of you focus on the camera. Okay, done. The meeting is now concluded. Thank you very much. Goodbye.